Hey guys, thank you all for being here. Esteemed panelists, thank you for joining me. So I want to take a second to blow all of your minds with a little news. The healthcare system in the US is broken. Yes, I know, thank you, thank you. In fact, the US healthcare system squanders $750 billion a year, roughly 30% of every dollar spent on fraud, unneeded care, paperwork, and all that fun stuff. However, recently, in health headlines, wearable tech, the Fitbits of the world, have been stealing all the headlines, which is why I'm so excited to be here today with these guys who are going to tell us about the future of diagnosis and where the real opportunities are in digital health. First of all, I want to ask you guys, why do you think that wearable tech has been so popular, and what does it mean for your businesses and for diagnostics?
I can start.
Erik, Elli, please.
Sure, I can start, if you don't mind. So I think wearable tech has been really interesting because it's kind of a transition point. It gives people an opportunity to engage with their health in a way that is, they can start to see the data, they can start to monitor what they're doing. It doesn't have all the complexity of having to interface with the doctor just yet. It gives them numbers and metrics they can look at and understand and try and improve on without having to have full buy-in from the rest of the system.
And what does that mean for Cellscope?
I think for us and for other hardware-based digital health companies, it's a really great sign because it shows that people are interested in using these sorts of devices, that they're willing to carry a little wearable dongle or some other thing that might not have been obvious a few years ago.
Thank you for saying dongle on stage. I appreciate it.
Drink. It shows that people are willing to engage with the tech in a different way than just carrying their phone. And so it's an opportunity for other hardware things to be able to bring in better sensing capabilities.
Right. Elli, did you?
Well, I was just going to say, I think that we all know how difficult it is to get change in a person's behavior. What I think we're learning is that, and we face every day, is that healthcare institutions and pharmaceutical companies and payers are even more entrenched and much harder to get any type of disruption or change in behavior. So, I think that because we're seeing some movement in one area of the market, that's exciting and people are picking up on it. And for Neurotrack, it's very exciting because, our technology, which is an early diagnostic for Alzheimer's disease, will rely upon a person taking their own health into their own hands and taking our tests and getting a diagnosis early.
So what I wanted to really hear from you guys is we know that the healthcare system is broken. We know that disruption is happening. Where is it really happening that the crowd may not be familiar with within diagnostics? What are some of the biggest trends that we're seeing? I mean, we know that costs are too high, that outcomes have been disappointing. But what are startups and companies doing to address this that's exciting that we may not know about already?
I think we have two excellent case studies here with Neurotrack and Cellscope. I think software entrepreneurs are using these tools that we've had forever in other industries and bringing it to healthcare to drastically reduce the costs and bring point of care to the patient in a way that is more comfortable, more accessible, and more scientific than we've had before.
And Elliot, just to quickly go back, since you touched on Neurotrack and what you guys are doing, can you, for the audience, I think you already started to, but just tell us a little bit about what it is that you guys do and why now? Why is Neurotrack possible now, but it wasn't 5 years ago? And Erik, I would ask the same of you too.
So our test is a computer-based behavioral biomarker test for early diagnosis of Alzheimer's disease. And what our scientists recognized was that that Alzheimer's is, it's this very complicated disease. We have not seen much success in the area of Alzheimer's in years. The pharmaceutical companies are failing. Researchers and physicians are just having a really difficult time making any type of progress. And so they stepped back and said, you know, maybe the way we're approaching this is wrong. Maybe we need to be looking at different ways of trying to diagnose the disease and understand how it works, and brought in technology as a means of doing that. So, you know, a lot of the research is around behavior, is around blood biomarkers or PET scans, MRIs, and they really saw that for the first time that we have this opportunity to use technology and to think about a different way of approaching the disease. And as, you know, through their research and studying, we're able to develop this test that is a computer-based visual cognitive test that can detect the disease earlier. And this wouldn't have been possible, you know, 5 years ago, as you asked, because, you know, for a number of reasons. I think first, just the whole market wasn't ready yet for thinking about a diagnosis of this type using computer technology. And I think it's only because we've had so much movement in lots of different areas of mobile health and you know, computer-based health changes that we've been able to bring it to Alzheimer's.
And can I use Neurotrack? Is it available to the public and widely to the consumer right now?
Yes, so we are running programs at a number of different Alzheimer's disease research centers and hospitals around the country. We have programs running at Harvard, Mass General, at Johns Hopkins, at Emory, and soon at Vanderbilt. So if you wanted to go to one of the centers, you could be tested there, but the consumer version will be available in the coming year.
And Erik, I would ask you the same question too. And I'm also curious if you guys have any advice for people in the audience who might be considering, I mean, there's a lot of talent that's moving now into health tech, which I think is really exciting and again, is contributing to all the opportunity that I think we're seeing in this space right now. Do you guys also have any advice for people considering starting a health tech or digital health company, or more specifically in diagnostics?
Sure. Yeah, so Cellscope is doing diagnostic imaging on the smartphone platform. We're building a series of attachments for the camera to be able to do diagnosis from anywhere. Our first product is an otoscope. So the most common reason kids go to the doctor is for ear exams, and it's such a simple thing. So that's what Vinod Khosla showed earlier this morning, is our otoscope product, where we can be able to enable a remote diagnosis from home or from anywhere. And really, it's improvements in the hardware. You know, the cameras have gotten better, but they're not. The camera alone on the phone isn't enough. And so what we do is add in hardware attachments that take the iPhone camera, for example, from being a really good snapshot camera into being a really good diagnostic instrument. So with our additional optics, our additional software, the full system gives us leveraging the smartphone people already have, turning it into a way for them to get high-quality diagnosis from anywhere.
And record video?
That's right, yeah. So we record video, we can extract frames. One of the exciting things really going forward is being able to automate some of that analysis and you know, help provide decision support.
So it just so happens that we may have a demo of Cellscope Auto, excuse me, set up. Should we?
Let's do it.
Should we show the people how it works?
Okay. Now, Rip did not have a chance to clean out the wax earlier, so we'll have to forgive him.
This is
if it's a little
we're
waxy.
Totally improvising this. I'm sorry if you guys are about to see some
Rip, is this
disgusting
your ear?
earwax buildup.
Yeah,
I'm
it's
sorry.
gonna be your ear?
I think it might be. I mean, if one of you guys has cleaner ears, we'd love to offer you. No? Okay.
All right. You're brave. Brave. Okay, so.
Thank you, doctor.
So we have here on the phone, we're running our app, and this enables the camera to get the right exposure and illumination. And now we position it real time. And Rip's here.
I'm so sorry.
That's gorgeous.
So sorry.
That's gorgeous. So you can see at the top there, that's the malleus, the hammer bone. That
is there anything in there?
The sound. There's
Are you seeing all the way through?
Just a little wax, but that's healthy and normal.
Good
and you know, with a video like this, we'd be able to show this in the clinic. Mom and dad could see it and understand what their child's going through. But really, it's for at home, so they can transmit that and get the diagnosis from anywhere.
Right, so this is for use at home, but it's also HIPAA compliant, I presume, will be, right? So
That's
that
right.
I can send this to my doctor,
Yeah.
and he can see just how, infrequently I've been
No,
de-waxing.
you have a lovely ear.
But see, right, and also if I'm looking at this, how am I, right, if there's a lot of inflammation or there's small little green creatures in there,
Right.
I realize that something's wrong, but how are you guys helping us to understand the average consumer, right?
Yeah, so initially the idea is that it's really based on telemedicine. It's transmitting the image from home, from the app, anywhere, to an expert, a clinician somewhere else who's able to interpret that image and provide you the diagnosis and prescription you may need.
Fire it right back at you.
Yeah.
Amazing,
But really one of the most exciting things is being able to help people not get prescriptions as needed, to help them have watchful waiting to treat it more
Reduce the
appropriately.
lines at the doctor's office and so on, right? Exactly. Putting technology that's traditionally only been in the hands of doctors into my own hands.
Exactly.
My own ears.
Yeah, right.
Well, Eric, thank you so much for that demo.
All right.
Thank you.
Very brave.
Thank you, doctor. So I wanted to use this as an opportunity, Eric, quickly, and to ask you about how this relates to Apple's news that they're developing, and Halle, you mentioned this backstage as well, that they're developing a wearable, some wearable tech. I'm curious more to whether we think that this is going to be, an industry-altering device. Does this have any real effect on diagnostics and digital health? Is Apple's entry into this space good for startups or not so much? What do you guys think?
Can I take that one?
That was
It's a tremendously positive sign for all of us, for entrepreneurs and folks in the industry and those wanting to come into the industry. If you guys, as developers, technologists out there, were to see the status quo of the technology that they're using within the healthcare system, you would just be absolutely appalled. There's a huge arbitrage opportunity to bring in tools that people actually want to use, that delight the user, that bring in all of the data available, and just really push forward the innovation in healthcare. So,
and not to put Eric on the spot, but I want to ask all of you guys: would you use this tool? Do you think that Cellscope Auto is going to be appealing to consumers? I mean, I would of course use, right?
I would use it all the time, and we had ear infections, and even if I wasn't able to diagnose it myself, just knowing that I could port it over to my pediatrician and not have to make the trip into the office would be huge.
Yeah, absolutely. I also want to change gears. Katie, I know your work at the Gladstone Institute is focused on making use of and unraveling large genomic data sets, and big data is another huge trend in healthcare right now. To better understand both health and human disease, I'm wondering if you can tell us a little bit about your work and how it's overturning what I hear some of the basic assumptions that we have about DNA.
Right, so for a long time, the rate limiting thing in science has been having enough data. And in the last few years, the situation has totally changed. And in my area of research in genomics, that's because of changes in technology, just like we were talking about. But in this case, technology for sequencing DNA. And now the rate limiting step is actually tools for analyzing that data. There is way more data sitting around on computers in laboratories and in the medical system than anybody touches. And I'm embarrassed to say how much of it is just compiling and nobody's doing anything with it. So what my lab focuses on is developing hardware, software, and most importantly, bioinformatics tools, statistical models for mining through this huge amount of data and trying to find the pieces of information that could go into the diagnostic tools that we were just talking about.
And I also know there was some big microbiome news recently too, which I'm wondering if you could touch on and also maybe explain it to the lay people in the audience.
Right,
like myself,
so Rip's referring to the microbiome, and that's the community of bacteria, viruses, and other microscopic organisms that we can't even see that live in, for example, Rip's ear that we just looked at. And
a lot of it,
in the area of research I've been focusing for years and years on human genetics and what can we learn from our DNA about our health, and we've made a lot of breakthroughs, and there's been some really exciting discoveries. And a lot of those have made it into clinical practice. But to be honest, there are so many diseases out there where we don't have an explanation. We don't have a diagnostic tool. Or if we have a diagnostic tool, we don't have a way to treat the disease, or we don't understand the mechanisms of the disease. Autoimmune diseases are a great example. I have an autoimmune disease. There's a genetic marker. Okay, it tells me I have the disease, but it doesn't really help me to get well. And the really amazing thing about the world of bacteria is that our bodies are actually more bacterial than humans. So bacterial genes outnumber your human genes off of your DNA 100 to 1 in your body. So if you're trying to figure out why you're sick, why you're obese, and your twin isn't, it's not going to be sitting in your DNA most likely. 100 to 1, the odds are that it's in the DNA of the microbes that are living in your body.
And Katie, am I right that until recently we've been solely focused on human genes, right? And
That's
human
right.
cells to
Yeah,
study
this is
diseases.
a major disruption in healthcare and in scientific research to suddenly realize that most of the cells in our body, most of the DNA is in our own. In a sense, it's coming from these bacteria, and that we haven't been looking at them. And there have been huge breakthroughs just in the last few years, understanding about obesity, autoimmune diseases, a lot of really untreatable, untractable diseases. It turns out that we just weren't looking in the right place. And ear infections are actually a great example. There was a patient here in San Francisco who had an ear infection that was intractable to all antibiotics, all antifungals. And for some reason, the guy decided to just try transferring earwax from his good ear into his bad ear, and he was cured. And it turns out that there were bacteria in the healthy ear that were missing from the sick ear, and so he just needed a transfer of bacteria. And so our goal is to try to develop these kind of probiotic treatments, and also in the short term diagnostics to try to figure out if you're sick or not.
In terms of the data crunching tools, are you guys developing some of these yourselves in the lab? Are they coming from startups or other companies that we might be familiar with? Is there any cool technology that you guys are using in the lab too that people might be interested in?
Yeah, we're building tools, but a lot of times we don't start from scratch. We take things that are out there in the public sector and we put them together in new ways. And
Right.
so everything that we build in my lab is open source, and we rely really heavily on the open source software community for a lot of things that we do.
Gotcha. Changing gears a little bit, Halle, I want to ask you about, you have a unique perspective on early stage startups and investment activity. So I'm curious what you're seeing from an investor perspective and from an entrepreneurial perspective. What are people excited about, and what are some of the trends that you've been noticing?
Yeah, well, investors from the tech community as well as the life science world are both really excited about digital health, and last year we saw almost 50% growth. This year a little less, but still a tremendous amount of money that's flowing into digital health. That being said, I think there's a gap between the kind of startup and venture world. There aren't a lot of angels, so we don't have the Facebooks and PayPals and Googles and healthcare to spawn off really great strategic angel investors. So what we're seeing is, we see tons of companies come through Rock Health at the idea stage, but there isn't a lot of support between that and when a VC would be comfortable investing.
I'm curious too how that's changed over, you guys are now on your fourth batch? Fifth batch.
Yeah.
Congratulations. And
Yeah.
how is that funding, how is the interest from the investor interest changed in your batches? As I understand it, it's...
Yeah, I mean, the companies
upside.
are doing really well. There are more investors that are willing to have those conversations. So we looked at all of the investors last year. There were 180 VCs that invested in the space last year, but the majority of them, minus maybe 10, actually only did one deal. So last year in 2012, it was a lot of dabbling, a lot of like, let me
So
try
they're still
this.
nibbling.
Yeah, like, okay, this kind of seems cool, but now we're starting to see some investors that are becoming quite prolific, including Khosla, Social Capital Partnership, Kleiner Perkins, these investors that are actually doing multiple deals in the space, which is a great sign because they're getting comfortable and excited about this funny world that sits somewhere between software and life science.
And another question from the investment perspective, are investors actually investing in companies that are really changing the world, that are really doing something disruptive, or is it still, listen, if only if revenue is looking like this and is really high?
Yeah, I think that's a great question. I mean, certainly the investors are investing to make money.
Of course, as always.
It's in their business model to invest for money, and I think the best way to ensure that they're investing in breakthrough ideas is aligning the margin and the mission. And so the companies, I would encourage anyone that's interested in healthcare is to really find a business model where the more money you make, the more good you're doing in the healthcare system. And if you can tie those two things together and figure out a business model that you only make money on cost savings or you only make money on improving outcomes, then everybody wins. The healthcare system is better off and you get to become a wealthy entrepreneur.
Good to know. I'm curious too, we touched on this a little bit already, but what are the challenges facing, right? I mean, we know healthcare is broken, so beyond that, beyond the big endemic structural problems, what are some of the things that entrepreneurs might face if they're trying to move into the space?
I could bitch to you for the next hour on this. I mean, there's the validation aspect, so finding a partner within the medical system to help validate your product, which is crucial. You have to know that it actually works. The sales cycle, if you're selling to hospitals, if you're selling to payers, it's a really long and arduous institutional sales cycle. The regulatory environment, the mobile health regulations are pretty vague, so none of us are quite sure what sort of apps make a smartphone a medical device or not. Cellscope went through FDA, Neurotrack probably is going through FDA as well. So having that expertise on a small team is pretty rare. So talent is a big challenge, finding people that really care about healthcare but have the technical capacity to build a company from the early stages. I mean, it's really hard. It's really, really hard. And if I would just say if you want to be a healthcare entrepreneur, there's a huge opportunity both to make a difference and to make a lot of money, but you have to want to make the difference because it is a lot harder than building a game or a social network.
Yeah, I would add to that though, Halle, there's a lot of opportunity for collaborating with people in academia who are familiar with all of those processes and familiar with the medical system. We're all really excited about what's going on in private industry, especially here in the Bay Area, and a lot of us are really interested in being on boards and collaborating. I've had people from a number of different microbiome-based companies come and present in my lab meeting, and we all have a really open exchange. And so I think that
how can we encourage that fluidity, Katie, between entrepreneurs and between researchers, scientists, because there obviously needs to be more of that.
Yeah, it's a great question because there is kind of this gap, and we think about it from the other side, and scientists is we want our ideas to be translated and we don't really know how to do it. And I think there's, on the other side, people who know how to translate to the general public and how to market and sell things, but they don't necessarily know how to mine through all the information and the processes. So I think it's like any part of industry that personal relationships and communication are really key. And I think opportunities like this, where you guys include someone like me in a panel and get to know people and networking, it's just the way the business works,
So another question I have is, I know the space is hard to get into, right? And it's not for the faint of heart. There's a lot of opportunity, but it's tough and it's a long-term play. The same is true of education. Jack Dorsey was asked by Wired how he was able to innovate in the payment space after companies had been working in payments forever and things had just been moving along incrementally and slowly. And he said that part of the reason that Square had been able to be so successful was because I think it was only 5 of their 200 employees at the time had actually worked previously in payments. Is that true for health too? I mean, is it badly in need of a fresh perspective? And can entrepreneurs coming from other sectors, if they're not engineering whizzes, can they still thrive? Is this still a good? And you guys went through, not to give an opportunity to high five Halle, but is it in that case too? Would you guys advise startups to go through an incubator? Is that a better way to approach it rather than?
Yeah, I mean, Rock Health was critical for us. It made all the difference in terms of being able to, I mean, my background is not in health, and I've done a lot of startups, but I knew that just given how complex the industry is, that if I didn't have a Rock Health, then, I would have been lost, and it made all the difference. I really think that, Rock Health is very unique in terms of what it does for its entrepreneurs and how it helps a company really navigate the system. And I don't know that you find that with other accelerators, but it's critical for healthcare and for starting new companies in health. And I think also for us, I think you need a mix of both, people who come from healthcare and understand all of the different nuances on your team in addition to the accelerator, but having that first perspective helps a lot too.
I think it's also, what the markets we're trying to enter are different, and the markets we're trying to create are different. It's not just selling to hospitals and big payers. With Cellscope, for example, a lot of our work will be targeting consumers and at-home users, and in that case, there aren't as many precedents, and a lot of it is, we'll have to come up with it as we go. So it's about validating the product and showing that we can give people better results, and we'll be able to take that to the consumers.
Awesome. Well, I have so many more questions for you guys, but I think, unfortunately, we're out of time. But I just wanted to thank you guys for coming up in here and sharing your thoughts. It's been great.
Thank you, Rip.
Thank you guys, and thank you all for listening.